So our show is here to answer your most pressing medical questions. But when we aren't on the air, there is something else you can rely on for your medical information. It's an app called Doctor on Demand.
That's right. And joining us is Carrie, who has a question about your allergies, right?
Absolutely, yes. About 4 months ago, I moved here from Minnesota. And ever since, my allergies have just been out of control. Now, I've always had allergies, but they're really bad now.
And you've probably tried a bunch of things already.
Tried everything. I've tried 3 different over-the-counter antihistamines and eye drops. Nothing's really working. So my question is, why is it so much worse here? And is it possible that maybe I've grown immune to my medication that I've always taken and it has worked?
Great question, and we've got someone who's going to help you out with this.
Great.
As a matter of fact, we're going to dial up. Here, I'll let you, just like you would be doing at home.
Okay.
Oh, it says finding a doctor. Oh, yeah. Oh, we're connecting with Dr. Tania Elliott. Nice.
Hi, I'm Dr. Tania Elliott, and I'm a board-certified allergist immunologist with Doctor on Demand.
Hi, well, I'm Carrie. I've got lots of problems with my allergies. Now, I moved to LA about 4 months ago. Ever since, my allergies have been out of control. The worst thing is my eyes. They're itchy, red, and they've been watering a lot lately. I've been taking medication, over-the-counter antihistamines, some eye drops. Nothing has been working. And I'm just wondering, why is it so much worse here, for one? And then, is it possible that those medications, that I've become immune to them? And what can I try next?
Are your symptoms worse when you're indoors or when you're outdoors?
I would say that they're actually worse indoors.
Have you ever been tested for allergies in the past?
I have. I've been tested, and I've tested positive for pollens, trees, cats and dogs, and then indoor allergies like molds, dust, and dust mites.
Wow. So Doc, it sounds like she's exhausted all of the over-the-counter options. Is there anything that you can do to help her?
I think so. The key in terms of allergies is avoidance. So let's talk a little bit about those indoor allergens, dust mite and mold. So if you were home, I would ask you to actually turn your phone around so that I could help identify triggers. Okay. But generally speaking, in terms of dust mite allergy, if you have carpeting, if you have any upholstered furniture, drapes or curtains, those are all places where dust mites love to live. So I would recommend that you would remove those things from your home, if possible, and then just replace the curtains or drapes with blinds. Okay, I do have curtains and carpet. The other key thing is the humidity level in the home, and that's important for both dust mite and mold because that's where they love to thrive. So if you're able to check the relative humidity in your building, and that's just with a simple humidity gauge, you can get that at the local hardware store. If your humidity in your room is greater than 50%, then you would benefit from a dehumidifier to suck that humidity out of the room, and that way the mold and the dust mite won't be able to thrive.
Anything you can give her, Doc, to kind of just help her alleviate some of the symptoms she's having?
Yeah, so I would recommend continuing a daily antihistamine, but I also think, Carrie, that you would benefit from a prescription strength nose spray that would help to decrease the local inflammation in your nose. And that's something that's not sort of an as-needed medicine. That's something that you need to take every day, and you'll start to see an improvement in your symptoms after about 5 or 6 days or so. So what I'm going to do is I'm going to call it into your pharmacy, and when we're finished with this call, it'll take a couple of hours, and then you can go ahead and pick it up.
Sounds great. Thank you so much.
Awesome.
Yeah, that's
Thanks,
great.
Doc.
Yeah. And this is a really cool app from our executive producer, Jay McGraw.